in your Health Watch today, Botox treatments are certainly becoming a lot less taboo, and more people are using them younger, more frequently to look their best. There are so many places now offering the treatments. I mean, just flip through your Groupons, and it seems like they're offered just at every single spot. But it's easy to book an appointment, but are you making sure that you're getting these treatments that can be dangerous in a space that is safe? So a couple of warnings that we want to address this morning, and some questions that you should ask before you make that appointment. Make sure that you're in good hands. Elizabeth Hallstrom is joining us from Derma Health Skin and Laser to give us some of that 411. We recently aired a story about a woman out of state who her facial tissue almost began to die because of where the injection went and how long she had to wait for a doctor to actually arrive on scene to remedy this. So talk to me about what maybe somebody should ask before they book an appointment.
So I think the biggest thing is knowing the person who's going to be doing the injection.
Okay.
Are they licensed? In this case, are they licensed in the state that you're having the treatment done? What are their credentials? Are they a medical physician? Are they a nurse practitioner, a physician assistant? Those are all people who can be licensed to do these kind of procedures.
Okay. So it seems that because Botox is offered in so many locations, places that specialize in other things, it sort of seems like there's an understanding that medical assistants and estheticians are allowed to inject Botox. Is that true or not?
So really you have to be licensed to do these kind of procedures. At the end of the day, injections are medical procedures.
Yes.
You need to take into consideration the person's experience and the training, because they need to have a knowledge of facial anatomy, muscles, blood vessels, as well as conditions that can impact how you respond to a treatment. So you really want someone with some degree of medical training and background.
And for most people, it's absolutely no problem, and certainly a beneficial process that they get hooked on right away, and preventative and to fix. But what can go wrong in those rare circumstances?
So in rare circumstances with things like Botox, a lot of it comes down to, is there too much injected? Their muscle can relax too much, meaning one of the forehead can become heavy, some drooping of the eyelids. In most of those cases, those are things that either wear off with time and don't have long-term side effects. When it comes to things like dermal fillers, there are some more serious side effects. Injecting into the blood vessel is the biggest thing. And so in those instances, you want to make sure that the facility you're going to has the resources and the medications available on site that would treat those kind of conditions.
And that's a big thing. So there are remedies for this to inject into the space right away if something has gone wrong and you sort of need to undo what's been done, right?
Absolutely. But again, those medications and the tools needed should be on site available, as well as the staff should be comfortable in how to use those. So there's no problem asking someone, do you have what's necessary should something go wrong while I'm in the office today?
What other questions should you ask before you go for it? Because you see some people who look fabulous, you see some people who just, it kind of everything changes and not necessarily for the better. So you want to, I imagine, start off slowly and maybe not too soon. You hear about this going on in a lot of people in their 20s, right?
So really doing injections in your 20s is becoming more and more popular these days. It's preventative. So really treating things before they become, something that needs correction. This is prevention, not correction at a young age. So definitely candidates in their 20s to do things like Botox. And again, just asking, who does your treatments? What kind of training? And really also in addition to training, does the provider do ongoing trainings? Are they staying up to date and current with the advances? Because in this field, things are changing so rapidly. You want to be sure that the provider knows what's going on and up to date.
Yes, that's what they should be doing every day, and you'll be in the best hands, right?
Absolutely.
Well, thank you so much. And you've got a couple locations in town, right?
We do. We have multiple locations throughout the valley.
Okay, well, we can find you online. And tell me the name of the facility again.
Derma Health Skin and Laser.
Thank you so much. Appreciate your time. Javier, maybe your 40s will take you in there, okay?
All right.